According to the Centers for Disease Control and Prevention, in 2010, over 38,000 people in the United States died as a result of drug overdoses. That's the equivalent of over 100 people each day. While some of these deaths involved illegal drugs, many are related to prescription medications, especially pain relievers. In response to this growing problem, Indiana is one of several states expanding the use of a first aid treatment that can potentially stop a drug overdose. I spoke with local experts who say this drug has a proven record of saving lives.
Many people associate the term drug overdose with a person using illegal drugs, but evidence shows the number of prescription drug overdoses in the U.S. is growing.
In this area, we've seen a huge rise in both prescription drug abuse as well as heroin, and there's a strong relationship between the two. Heroin has become much more pure, it is cheaper, it is much more available than it ever has been, and prescription drugs have become a little bit harder to get. They're more expensive, that what means, and so people can start developing an addiction to prescription drugs and then switch over to heroin. The reason these kinds of drugs have to be very carefully monitored by a medical professional is the profound impact they can have on someone.
Death from drug overdose is generally caused by a shutdown of the central nervous system, often causing a person to stop breathing.
Their respirations are going to be very shallow if they are breathing at all. Their heart rate's going to be nearly stopped. The patient is basically unresponsive.
But what if a treatment could be injected or inhaled that would quickly block that effect and allow a person to continue breathing?
When we give this, you're going to see an increase in heart rate, an increase in respirations, and then a change in mental status where they're talking to you, they're now awake and breathing and able to function again because the drug has been temporarily removed from the system.
It's called naloxone, and it's been available to doctors and emergency medical technicians for decades.
Basically what this does is this drug goes to the receptor site and blocks the receptor from taking on that drug or that chemical, basically reversing the action of the pain medicine or the street drug.
As the number of drug overdoses continues to rise, Indiana is joining other states in increasing access to the treatment.
Senate Bill 227, which is known as Indiana's Lifeline Law, this year it was amended, and in part of those amendments, naloxone was added to the bill to make it available for use and possession by all of the first medical responders. So before, where just paramedics and advanced EMTs could use it, now emergency medical responders and EMTs also can administer it, as well as law enforcement officers and firefighters.
EMS is a response business. Police, you're patrolling. So police are out on the streets. If the call comes in, they're usually on scene a minute or two prior to our arrival. If they get there, they can recognize the signs and symptoms of an overdose. They can administer this drug.
Experts caution that naloxone is not a cure-all, only a first aid. Naloxone only works on opioid drugs, and further treatment is always necessary.
It only has so long of a life inside the bloodstream. Eventually, it will stop working, and if there's an excessive amount of drug in the bloodstream, the drug will then take over again.
While most agree that the treatment is not perfect, if it means the difference between life and death, it's certainly worth further consideration.
It's a rescue kit, it's a rescue tool. When naloxone is used, if you have it, you want to call, you want to make sure the airway is clear, you want to administer naloxone and help with rescue breathing, and wait for emergency medical personnel to arrive on the scene. But the difference in the minutes that where you can give and administer naloxone can mean the difference between hypoxic brain injury and death or a much better outcome. So the sooner you can get naloxone, the better results, the medical results will exist.